so much for joining us today. We're here to discuss an incredibly important topic, diabetes. Managing and preventing diabetes requires a comprehensive and holistic approach that addresses lifestyle, nutrition, mental health, and medical care. Whether someone is trying to prevent type 2 diabetes or manage type 1 or type 2 diabetes, a combination of strategies can significantly improve outcomes. Today, we are joined by Dr. Shweta Budyal, consultant endocrinologist and diabetologist from Fortis Hospital Mulund, Dr. Farah Ingle, director internal medicine and senior consultant diabetology, Fortis Hiranandani Hospital, Vashi, Dr. Arun Bal, director diabetic foot surgery, SL Raheja Hospital, Mahim, a Fortis associate, and Dr. Sandeep Patil, chief intensivist, Fortis Hospital, Kalyan. Let's now begin by talking about the most debated aspects of diabetes management. That's diet and nutrition. I'd like to begin with Dr. Shweta Budyal. Ma'am, can you elaborate for us the role of diet and physical activity in preventing pre-diabetes from progressing into type 2 diabetes?
Right. Thank you very much for inviting me. It's a very important question because from the studies now we see that the prevalence or the rates at which the people have started developing diabetes has kind of stabilized, at least in the urban areas, but the pre-diabetes continues to grow. And these are the individuals who would transition into diabetes eventually in few years. And if we look at Indians, the risk of transitioning from pre-diabetes to diabetes is very high, and that also happens over a short span of time. So if we catch these individuals early who are at risk of developing diabetes when their sugars are still borderline, they have not developed over diabetes, I think we have a very great window of opportunity to work on them to prevent or delay the onset of diabetes. And two most important things that I would advise is some amount of weight loss and reduction of carbohydrates in the diet. I would say these are the two most effective and important ways to prevent the onset of diabetes if you already have diabetes. So, how much weight do we need to lose? Prevent conversion from pre-diabetes to diabetes or to go back to normal blood sugar levels from pre-diabetes. It's just 5 to 10%. It's not that you have to lose whole bunch of weight. So if you are a person who weighs 70 kg, you lose 3.5 to 7 kgs of weight and your sugars would be mostly normal,
Right.
or at least there is 80% chance that you wouldn't transition over to diabetes in next 5 to 10 years time. So
Right.
mild moderate amount of weight loss, and that you can achieve by avoiding unhealthy food options, reducing calorie dense foods, fatty foods, junk foods, or treat foods, and controlling the portion. I mean, even if you are eating healthy, if you and you are in a pre-diabetic zone, you will have to come down on the portion size to reduce the
Right.
amount of calories that you're eating and to bring about the weight loss. And the next important step is the carbohydrate content of your meals. If you look at the Indian meal, almost 80% of it is carbohydrates, whether you go to east, west, north, anywhere in India. So basically, if you reduce carbohydrates, even if you are not able to achieve the weight loss, your A1Cs will definitely go down. So basically,
Right.
for that, you have to have the basic knowledge of nutrition, what constitutes carbohydrates in our diet, and most important is avoiding simple carbohydrates, the ones which are quickly broken down into glucose, your sugar,
Right.
rice, potato, refined flour, etc. And of course, as we go ahead in our discussion, I think Dr. Ingle would shed more light on lifestyle interventions, stress management, adequate amount of sleep. These are all very important.
Absolutely. So that brings me to my next question for Dr. Ingle. So, ma'am, what are the most effective lifestyle interventions that one could go after to prevent type 2 diabetes, especially amongst those who have a family history or who are at risk?
Yeah. At the onset, hello to everyone, and thank you for joining me in. And as rightly said, it's a continuation of Dr. Shweta's question. I can say the answer continues. From my side, a combination of healthy diet and exercise are the most effective lifestyle interventions for preventing type 2 diabetes. We have a choice. It's not that we don't have choice because we have restrictions. We can include lots of and varieties of foods. We should concentrate on whole unprocessed foods. We should emphasize on vegetable intake, fruit intake, whole grains, lean proteins. If you are a non-vegetarian, go for lean white meat instead of red meat, and also healthy fats. Fats are also necessary. As rightly said by Dr. Shweta, we Indians are more carbohydrate eaters. We need to cut that down, and it has to be a healthy, balanced diet with less carbohydrate, proteins, and should not include saturated fats. We have to avoid saturated fat. And
Right.
also controlling portion size is important. Reduce calorie intake, but a balanced diet. And overeating, especially the refined carbs, sugars, it increases the risk of insulin resistance and also weight gain and obesity. Obesity itself causes so many other problems. Insulin resistance is one of it. So reducing calorie intake can help manage the weight and also prevent diabetes. We should go for foods which have low glycemic index rather than those with high glycemic
Right.
index. That means non-starchy vegetables, and a limitation in the portion size of the fruits, because fruits also have their own sugar content which can add to your blood sugar levels, and these all contribute significantly. Then second is about exercise. Exercise every day will be good. It is actually a 30 minutes of moderate intensity exercise. And if you are
Right.
used to moderate intensity exercise, you can even go for vigorous exercise, and then breaking about long bouts of inactivity, sitting on the computer, because or otherwise desk job, because nowadays they say that sitting is new smoking. That we have to
Right.
avoid. And depends on what activity. Like moderate intensity activity includes vigorous walk, swimming, cycling, whatever. And if it is there every day, it will be good. Otherwise 150 minutes in a week is must. That will help in increasing the insulin sensitivity and reduce insulin resistance. So that's very important. Apart from the regular physical activity, apart from diet control, what else is important is the quality of the sleep. It has to be at least 7 to 8 hours of peaceful, uninterrupted sleep. It should not be
Right.
less than 6 hours. It should not be more than 9 hours of sleep. Both ways is not good. Avoid too much of sleep during daytime. Nighttime, it has to be proper sleep. Go to bed early, get up early. That sleep hygiene, because that also helps in reducing the risk of developing type 2 diabetes if you have proper sleep. Sleep quality is definitely very, very important. Then weight management, if you control your diet, if you do exercise, you can keep your weight under control. If your weight is under control, like even 3 to 7% of weight reduction reduces the risk of developing type 2 diabetes by 60%. That's what I know about. 10% is still better. Try to keep the weight under control. And then we can even do routine health monitoring, especially if you have family history of diabetes. Nowadays, more and more people, in fact, we have seen that diabetes has now become so common and the numbers are going to increase only. It is
Right.
from 20 to 70 years, people are more affected. So, right from 20 years onwards, you should start screening yourself so that you can detect yourself even in the pre diabetic stage and take necessary precautions to prevent from progressing.
Absolutely. So you spoke about, lifestyle interventions, and I would now want to bring in the element of multidisciplinary care and, talk about clinicians who work behind the curtains to sort of enable the patient to get there. So, Dr. Bal, my next one is for you. Can you tell us a little bit about the importance of a multidisciplinary team who can help patients manage diabetes effectively?
See, diabetes affects mainly four organs, that is eyes, kidney, heart, and feet, that is legs, lower limbs. So this is a very disease which affects multi-system problems. So you need to have a separate specialist for that. Basically, the team leader is an endocrinologist or diabetologist, but you need to have somebody who can look after the patient's kidneys, heart, because it's not only the blood sugar. Along with blood sugar, other organs are what are called as the target organs get affected, and these need to be monitored every year or periodically depending upon how the progression occurs. So that's why, you know, there are two options. If the person is in a place where there are not multiple specialists, I think we should have a system where the doctor who is there is at least equipped with a basic knowledge of all problems related to kidney, heart, and
Right.
feet, eyes. So regular examination of all these target organs is very important, because once the target organ starts getting affected, once the patient's HbA1c start crossing 7, then the problem starts. So I think important is that in a bigger center there has to be multi-speciality clinics or multi-speciality facilities available, but at a lower level, I think the primary health physicians should have a basic knowledge of how to detect an affection of these organs by
Right.
simply doing a routine urine test or routine ECG and examining the feet and providing patients foot care, that they have to walk with the proper footwear, take care of the feet, cut the nails properly, and take care of the skin of this foot and leg. So at that stage, if it is managed, then you don't require a bigger multi-speciality hospitals and cities. But at present, that is a deficient, because of foot is one target organ which is not usually regarded in medical education as a target organ. But that situation is slowly changing as the number of diabetics are increasing. And the recent ICMR statistic shows that we have 100 million diabetic patients, and
Right.
unfortunately, our lower limb amputation rate is very high. It is every year there are more than 2 lakh below knee or above knee amputations are done. But 85% of them are completely preventable. They are because of a neuropathic wounds which occur because patient does not use proper footwear, and patient is walking barefoot or applies some very strong ointments to the leg for neuropathic pain. So this basic care has to be taught. That's why I think at a three levels it has to be done. One is at a primary level, the primary physician must be equipped with a basic knowledge of this target organ affection. At a second level, where patient can be treated at basic problems like if there are calluses and corns, and advice about the footwear and kidney function, routine kidney tests, routine heart
Right.
tests. And at a higher level, of course, if the patient has a complication, then he needs a tertiary center.
Absolutely, sir. So you spoke about two aspects. One is the care that your primary physician can offer, and then the spectrum of complications that could happen if it is not managed effectively. So that brings me to Dr. Patil with my next question.
Yeah.
So how are diabetes-related complications like diabetic ketoacidosis, for example, how can they be prevented, and what signs should individuals and caregivers watch out for to avoid ICU admissions?
Basically, diabetic ketoacidosis and hyperosmolar non-ketotic coma states are usually complications of diabetes, usually seen in uncontrolled diabetic patients. So to prevent that, basically, patient needs to keep his sugars under control, regular monitoring of sugar, taking medications, insulin on time as advised, regular follow-up with doctor, and keeping adequate dose of medications and insulin, so that mostly in elderly patient, so that they don't skip the dose of insulin or doses,
Right.
oral hypoglycemic agents. So and next thing is educating the patient and caregivers about signs and symptoms of these complications. Patients will have if they have very high sugars, they will have increased thirst, increased frequency of urination. In diabetic ketoacidosis, patient will have abdominal pain, vomiting, breathlessness. In hyperosmolar patient may have fever, then altered mentation. So if these signs are there, they need to contact their primary physician or emergency care, so that treatment can be started on time and further complications can be prevented.
Absolutely. So you spoke about the challenges, in managing critically ill patients with diabetes. Dr. Shweta Vidyal, I would actually want you to add a little more to this discussion, where I'd like you to talk about what are the specific needs of patients, when it comes to differentiation between non-diabetic patients in ICU setting.
As in
Uh,
differentiation between diabetic and non-diabetic patients. Okay, so how does the care differ is what you want to ask?
Yes. So, how do the caregiving needs change from non-diabetic patients and diabetic patients in the ICU setting?
Correct. So we need to understand that patients who are admitted in ICU, at least 50% of them have either diabetes or they have high blood sugars, even if they are not diabetic. When a person is very sick, there is surge of stress hormones like adrenaline, noradrenaline, cortisol, growth hormone. All these hormones basically raise our blood sugars. And it is very well known that patients who have high blood sugars when they are critically ill, their outcomes are poorer compared to patients
Right.
who have had better sugar control with respect to need of ventilation, hospital stay, hospital acquired infections, their mortality, chances of recovery, all these things can get affected by the blood sugars. So basically, whosoever is admitted in the critical care setup, if he is found to have high sugars, the sugars need to be managed quite intensively. And we do have protocols for that. So other challenges there being that most of the patients are not able to eat their food, or they are kept what is called as nil by mouth. So
Right.
they are they are coming up with some procedures, some imaging modalities, or they don't have, they are in not normal sensorium, so they are not able to eat. So there are a lot of challenges. So what is most important is frequent monitoring of these patients, to have with point of care devices like glucometer, to train your nursing staff to take decisions, to have some set protocols or standard operating procedures. And third is frequent assessment and transition. So whenever the patient, he starts becoming better, we also immediately change their target blood sugar levels that we need to achieve, and change the treatment modalities. So most of the
Right.
patients in the ICU will require monitoring quite often, as well as majority of them will be on insulin rather than the oral tablets. And I think it's quite challenging, because insulin requirements in ICU setup when the patients are sick can sometimes be quite high. Patients may require more than 200 units of insulin. They may require
Right.
very high, very frequent monitoring. Also, the risk of hypoglycemia, when we aim for more intensive, targets, or more tighter targets for sugar control. Patients are not eating. They are also on multiple medications. Their kidney liver functions are not up to the mark many times, which actually decide the way our diabetic medications are going to work. The risk of low sugars is also quite high, and which may again cause more problems to the patient. So I think monitoring is the most important thing.
Right. So, thank you. That was very insightful. I want to now come to a very important topic, that's diabetic neuropathy, with Dr. Farah Inle. Ma'am, could you tell us how diabetic neuropathy and poor circulation can lead to causes of foot problems, in diabetes, and what are the early signs that should not be ignored?
Yeah. So as neuropathy is concerned, a common complication of diabetes is seen in about 50% of diabetic when the sugars are not controlled. And early signs of diabetic neuropathy, poor circulation, and closely monitored, can lead to serious complications left untreated. I know is about 50 non-traumatic amputation of usually diabetes. So early signs of neuropathy could be or tingling of pins and needles, or numbness, particularly toes in the feet and even hands, and especially so more at night. And it may be
Right.
sometimes a sharp burning of feet. There will be sensations, difficult heat, cold, pain at in the feet, more so at night, and also muscle weakness. Weakness or imbalance in the feet, deformities that in the shape of the feet, omas, there can be callosities, there can be calluses, God's foot, which the bones in the foot also collapse. So poor circulation in the form of cold, persistent cold feet, a chilling sensation feet, and more so at other changes may be there. It may appear pale, blue, or red, and stand or sit period of time, swelling on the feet, on the legs, and it will not heal. No healing or non also points towards diabetic foot. There can be loss of hair on that affected area. All the symptoms and signs which helps us to pick up neuropathy, symptoms and signs. And what preventive measures we have to take is we should keep the blood control. With diet, exercise, monitoring of the time, regular, very, very important. We should inspect our feet for cuts and bruises, wounds, pores, or even there is infection. You can use mirror to check the bottom of your feet before you go to sleep. One is you should wash your feet with mild shampoo, with mildly lukewarm water. Check the temperature of, otherwise the patient may get loss of sensation. And then you can moisturize completely, especially in you'll get fungal infection and a moisturizer before. Then proper food is very important. It has to
Right.
be properly fitting shoe. It has to be soft and padded. And clean the house. Don't walk or use a slipper. Secondly, the socks that you use should be preferably waterproof and it should not be with a tight elastic band. Good foot hygiene goes a long way with food. Then even smoking. Smoking can affect the circulation. So if you're a smoker, stop smoking. Exercise regularly also for the same reason to maintain
Right.
circulation of blood. And apart from managing blood sugars, you have to manage associated conditions like hypertension, managing your cholesterol, and so many other things. Food is very important. Keep your food clean, manage other health conditions, even quitting smoking, avoid issues, and food is very important.
Absolutely. And on the point of diabetic foot, I would like to bring Dr. Balian again. And I would like to know what are the factors that contribute to the decision to amputate a diabetic patient's foot or limb, and how could these outcomes be prevented?
See, normally, if the patient comes with a foot wound or a foot sepsis, the aim should be to save at least walkable foot. But that all depends upon what stage patient comes. And there are three
Right.
factors: whether the patient's blood circulation is adequate or it needs to be improved. Second, whether the mid-foot joints are involved, where there is, these are the joints which bear the weight, and whether the infection is spreading above the ankle joint. So usually these are the patients who may have what we call painless, painful foot, in the sense they don't get a pain, but that's why they keep on walking on the wound, and then when it spreads, they started getting septic symptom, as Dr. Shweta has said. So the decision is always to save a walkable foot, because see, the average statistics, Indian as well as international, shows that a person who undergoes below knee amputation or above knee amputation, the mortality at the end of 5 years is 85%. The reason
Right.
is that, even if you give a very sophisticated imported prosthesis, which may cost 7 to 7.5 lakh rupees, it has to be lifted by remaining part of the leg, which is neuropathic. So it's like having a, dumbbell in the hand every step, which is 2.53 kilos. That puts the strain on the patient's heart, and slowly patient goes into left ventricular failure. So you can have at least walkable foot, or with a modified footwear. So that is always the effort, to keep the patient walking with his own foot and with a proper footwear. But the decision to amputate at a higher level comes when there is a multi-system failure, patient is going into sepsis causing damage to his heart and kidneys, and most important, the vascularity is very poor, which
Right.
happens basically because patients don't undergo regular vascular and neuropathy examination, which should be done every year by the primary health physician. It is very simple thing. It doesn't need any technology. It just needs a sphygmomanometer and something called monofilament, which tells you the level of neuropathy and level of vasculopathy. So measuring an ankle brachial index, which can be done by any paramedic or any attendant, is the primary test. If the ankle brachial index, which is normally 0.9 to 1.1, is coming down to 1 or zero point 0.9, then it is a sign that patient is heading for a vascular problem. So these
Right.
are the condition where, very few condition where you cannot save the foot, but otherwise, I think almost 80% patients you can easily save the foot if the patient comes early and the primary physician detects the sepsis, early, which is something which is lacking across India, because the primary physicians and our medical education does not have input about diabetic foot adequately.
Right. So you spoke a bit about, how screening is important, and why it needs to be taken up as a priority for by the patients. So could you speak a little bit more about what could be the modern treatment options, such as advanced wound care therapies, for example, that could be offered to patients who are at risk of amputation?
See, if there is a ischemic wound with a less blood flow, we routinely do peripheral angioplasty. Like it is done for a heart, can be done for the legs and improve the blood flow. If there is a wound which is ischemic, which cannot be improved, then there are various modalities like giving, oxygen to the leg. Hyperbaric oxygen is well known, but now for over last 5 years, technology to give a local oxygen to the leg. There are electronic devices which can be strapped around the knee joint, which stimulate the blood flow. There are dressing materials which improve. There is a method of called, negative pressure wound therapy, which can be applied to the wound and which improves the vascularity and healing of the wound. So these are various technology, now the stem cells are coming in a big way, where there is a blockage in the vessel which you cannot open. Then you can, along the blood vessel, inject, multiple small doses of stem cells which are acquired
Right.
artificially and are ready-made available. The problem is the availability of all this technology, even at a district level, is not very good, even in place like Maharashtra. And stem cells and other things are uh, non-availability, plus the cost is something which is important. But all these advanced technologies are available, as good as what is there abroad. So I don't think technology-wise we are behind. It's the availability, use of that technology, and affordability are the issues.
Absolutely. So, Dr. Patil, that brings me to the next question. Dr. Bal said that the technology is here. We just need to optimize it so that we make it available for patients. So, in an ICU setting, for example, how could healthcare systems be made better to improve coordination and better prevent diabetes-related ICU admissions?
Yeah, basically to prevent complications, you need to have multidisciplinary team and patient-centric approach. Multidisciplinary team should have primary care physician, nursing educator, a nutritionist, and consultants who look after complications such as neurologist, nephrologist, uh, uh, foot surgeon, ophthalmologist. So the team should be there to look after and to monitor the patient and look for any
Right.
complication. And second thing is most important is patient education. The patient and caregiver needs should educated up and need to understand about the disease and its progression, complication.
Right.
They should be taught about how to monitor glucose levels, taking medication on time, regular follow-up with doctor, maintaining the goals such as HbA1c less than 7, maintaining lipid levels, blood pressure less than 130/80, then vaccinations to prevent infections such as influenza, pneumococcal vaccination, regular eye examination to look for retinopathy, then daily foot examination to look for diabetic foot or any neuropathy. Then next thing is follow-up care. Patient should follow up with their primary care physicians uh, for monitoring of sugar and look for any developing complication. And next thing is individualized care. Then patient with special needs should be have individualized care plans. The next thing would be a continuity of care. Patient should focus on continuity of care between inpatient services and outpatient. So the care can be continued. Okay, so this will prevent complications and ICU admissions can be prevented.
Right. So that brings me to the patient's social environment and how it plays a role. So, Dr. Ingle, if you could tell us a little bit about, in diabetes, what is the role that a patient's social environment plays when it comes to offering treatment?
Yeah. So in diabetes, which is a chronic disease, the role of patient's social environment, including the family and the community resources and socioeconomic factors, is very crucial in managing and monitoring diabetes, because this can significantly impact on a patient's ability to follow a regimen, treatment plan, which is a lifelong plan. You have to stay with it. It comes in a new form, and we have to maintain our habits and ultimately manage the disease progression of diabetes. So, how does family support helps us? One is the emotional support. Family members can provide encouragement. They will give a feeling of isolation to the patient. They will help with the emotional stress of living with a chronic condition like diabetes. And this emotional well-being is linked to stress management also, because if a person is stressed, it will shoot up the sugars, it will shoot up the blood pressure, De-stressing will help in lowering the blood sugar level, and it will be a shared process where the whole family can assist planning with cooking, making healthy food choices. It is essential for diabetes management. It cannot be monotonous. We need to have flexibility. It can be done with the help of dietitians being involved in the family. They can help in monitoring the sugars of the patient, which will help in preventing complications. Or the family members should also be trained to pick up complications like sometimes hypoglycemia, unaware, or complications like diabetic retinopathy is happening. They may assist the patient in detecting them. And then community programs, so access to diabetes education, community programs which can often provide access to diabetes patient education. It helps the patients also to know about blood sugar monitoring, how to administer insulin, about diet management and exercise. These programs will empower patients to manage their conditions more effectively. They are being monitored, they are being guided, they are being supported. So if someone is diabetic and are in touch with them, they will encourage the patient to stick to them. And support groups are there.
Right.
Local diabetes support groups can help patients feel connected to others who suffer from the same condition. And then group support is very important. It can encourage adherence to the treatment regimen and also provide practical tips for managing diabetes. Fitness programs are also growing. Many cities offer low cost or free exercise programs which caters to individuals with this chronic condition. Then socio-economic factors also have to be taken into consideration. So access to healthcare, socio-economic situation will determine the patient's ability to afford healthcare. So that is one thing. Nutrition and food quality, socioeconomic factors also influences access to the healthy, affordable food that has to be there. We have insurances, health insurances. So individuals with lower socioeconomic status who lack adequate health insurance, limiting their ability to manage diabetes effectively requires monitoring of the sugars and necessary treatments. So uninsured patients can be helped, and if they get insured, they will have the advantage of management, monitoring, and that can help in preventing complications. And then chronic conditions and de-stressing yourself, as I've just said, that somebody can just shoot up your sugars. Support
Right.
programs are there. So all this together actually helps the patient in maintaining the blood sugars and helping them from landing up in complications. That's
Right.
what I feel.
So, ma'am, of all the important aspects that you covered, I would like to speak a little bit more about access and affordability. And my next question is for Dr. Budyal. Ma'am, how can healthcare systems address the disparities in diabetes care and prevention across different populations and, particularly the underdeserved communities?
Right. So disparity in the care, we think that it's a problem of India alone because we're a developing country. But disparity in the access to care or affordability is a problem across the globe. So even in countries like USA, there this is challenge. I mean, making anti-diabetic medications, insulin to all the remote areas is quite challenging. So I think multiple actions need to be taken at individual level, at health care provider level, as well as some measures need to be taken by the policy makers or the government. At individual level, I think as care providers, we can empower our patients with a lot of information. Self management is very important in diabetes. So the patients have to learn how to monitor the sugar, how to identify the symptoms of low sugars, high sugars, what basic adjustments in the medicines or insulin doses they need to be making if there are intercurrent illnesses or ups and downs in the sugars, basics about diet, physical activity, all these things. So self management is extremely important in diabetes, like any other chronic illness. Similarly, the family members need to understand what care they need to provide to the patient in case of emergency situation where the patient has hypoglycemia and he requires assistance of another person to recover from it, as well as support. Family support is of paramount importance.
Right.
Uh, then second, making the care available to majority of the patients in our society. I think for that we have to devise some indigenous equipments, glucometers which would cost less, glucometer
Right.
strips which would cost less, I think we don't have any dearth of people, intelligent people
Right.
who are working in the field of technology. So we can bring in that, making available the drugs and insulins at a lower cost, incorporating more and more patients in some form of government schemes or insurance. Hardly any insurance. I mean, very few people in our society actually have insurance available for outpatient care. Most of them, I mean, many of them have insurance for inpatient care, but
Right.
majority of patients will be availing of diabetes care in the outpatient settings, and they hardly have any cover to pay for the doctor's visits as well as the medications.
Right.
The diabetes medications on long term could be quite expensive. Third is at the governmental level, they have to build the capacity as well as infrastructure. So training more doctors, empowering the primary care physicians to provide care, and only patients who require more multidisciplinary care need to be referred, so that we kind of prioritize, or we have a triad system to
Hmm.
decide if patient goes to more advanced care facility. I think all these things would help, if to help more patients have access to better care and prevent complications. And treating early on in the disease, monitoring them for complications can actually be very cost effective in long run. So in short run,
Right.
it appear that we patients are spending more on all these screening tools,
Right.
but it can prevent bigger problems, hospitalizations, and procedures, which actually will end up in saving a lot of resources.
Right. So early screening remains the key point of the discussion. Now that I actually want to come back to one of the initial points that were discussed, when we began this panel, was the importance of mental health support. So Dr. Patil, I want to understand from you, how can we better integrate mental health support in diabetes care and offer the kind of support that, patient with a chronic condition like this could benefit from?
Yeah. So, mental health issue is a very hot topic, basically commonly seen in diabetic patients. So patients living with diabetes they feel burdensome. They can have anxiety, basically due to constant demands that and complication developing can further add to the problem. So common psychological mental health problems seen in diabetic patients are depression, mood disorders, anxiety. So,
Right.
diabetic is often associated with significant emotional burden, distress over
Hmm.
self-care regime, and stress in relation with their family, friends, and as well as the healthcare providers. So,
Hmm.
depression is commonly seen in diabetes. Almost 25 to 50% people may have one or other depressive symptoms. They would present with basically lack of interest in previous activity which they used to enjoy, then feeling of sadness, then uh, lack of sleep or excessive sleep, then eating disorders, not feeling like eating or excessive eating, sometimes suicidal ideation, body pains, multiple psychosomatic complaints can be there. So it's necessary to recognize all these symptoms during uh, visits, and you need to have multidisciplinary team. So the caregiver as well as the primary physician, even you need to have a psychologist, a psychiatrist in the team to identify these patients so that they can be treated early. Basically, worsening mental health will also worsen the diabetes, and it's
Right.
vice versa also. Worsening diabetes and developing complications such as vision loss, stroke, patient getting bedridden, or loss of limb secondary to gangrene or peripheral vascular disease can further increase the mental health problems.
Right.
So it is important and to recognize it early and start treatment. So if
Right.
you treat one, the other starts improving on its own. So if you treat diabetes, the mental health issues will also start improving. That.
Right. So a multidisciplinary approach will help take care of the mental health aspects of the patient as well. So now that we've spoken about where diabetes management stands at this point, I'd like to speak about what the future would look like. So Dr. Bal, I would like to get your opinion on what could be the most promising research areas or innovation in diabetes care that could change the landscape of how we prevent, treat, and manage diabetes in the next 10 years.
See, as far as the food is concerned, the research area which is already going on, we are conducting research with IIT Bombay of why the foot gets affected. Even if the nerves are not working, basically what happens is that the elasticity or durability of the plantar skin, that is the foot skin, goes on changing. So the stretchability reduces. So there's a very basic level research we are conducting with IIT Mumbai now in their biotechnology department, how to prevent that at an earlier stage when you can detect that the skin contents are changing and the skin elasticity is reducing. Now, if you do that, then at that stage you can easily reverse or prevent the foot ulcers and almost completely prevent the amputations, because then the wounds will not occur. Also, there is another research which in Amrita Institute is primarily completed, where I'm a visiting professor, is that to give a footwear which has which molds to his patient's foot shape automatically. But this is a material which is created with 7 different grade polymers by Amrita University in Ettimada near Coimbatore in their engineering polymer engineering department. So we have completed the trial for the material sensitivity, and now we are waiting. This is a Government of India Biotechnology Department project, and we will be doing the human trials with the footwear. So these are, if such a footwear is available and patient uses it right from the beginning, the chances of getting ulcer, cons, and calluses is almost completely prevented. So these are the two research. Stem cells are already there in the market, so that's
Right.
not actually new research. It is there for last at least 5 years. But important is that how to prevent the breakdown of this foot skin. It at the very basic level, these two research projects are going on.
So these two research projects do hold a lot of potential, and we hope that in the next 10 years there's a lot more newer technology that gets adopted, and we see better care being offered to patients who come in to us. With this, I would like to thank all our distinguished panelists for joining us today and for sharing their valuable insights on the occasion of World Diabetes Day. Also, a big thank you to our audience for their thoughtful participation. As we wrap up this important discussion on managing and preventive diabetes, it is clear that it's a multifaceted issue, one that requires a collaborative approach. Before we conclude, I'd like to ask each of our panelists to leave us with one piece of advice for those who are either living with diabetes or those who are at the risk of it. One piece of advice that they should, keep in mind. Dr. Ingle, we could maybe begin with you.
Yeah. Thank you. See, diabetes, as I said, is a chronic metabolic illness with multiple etiopathogenesis, and it stays with you. So managing diabetes is a holistic approach. What is important is proper diabetic diet, exercise to keep yourself fit, and then no stress. Stress shoots up your sugars. Proper sleep. Sleep hygiene is very important. 6 to 7, at least 8 hours of peaceful, uninterrupted sleep. And also social, like along with the other conditions, you can do get to the regimen. So be social, be spiritual, keep yourself healthy by eating a healthy diet and exercising and taking medicines regularly. And also regular checking of the sugars is very important, because everyone will not have symptoms all the time. There can be hypoglycemia unawareness. So periodic checking of the sugars, consulting your doctor from time to time, so that you keep the sugars under control. That way you can prevent yourself from getting or landing up into complications and keep yourself healthy.
Thank you. Dr. Bal, can we have your advice for our audience, please?
See, the main message is never walk barefoot, even indoor and outdoor. Use proper footwear. Never use a footwear with a web strap, because it is going to cause damage. And every day examine at the end of the day your feet for 4 things. Is there any injury? Are there any blisters? Are there any calluses which is formed? And keep the foot clean. And just wash with a simple tap water, wipe it, and apply mild moisturizer before sleeping. I think if the patient does it, there is no chance of him getting corn and calluses.
Super. Dr. Patil, could we have your closing
Yeah.
advice, please?
Basically, doing regular health checkup even for non-diabetics, so that they can have a regular health checkup and they can have blood sugars done every year. So if they have diabetes, they can start treatment And for diabetic patients, taking medications on time, regular follow-up with doctors, maintaining sugar levels, and looking for complications will prevent and further issues.
Thank you so much. The session was absolutely insightful, and I'm sure our audience has a lot to take away from it. We'll request our audiences to share questions, if any, in the chat box below, and we'll be happy to address those. With this, we conclude this panel discussion. Thank you so much for joining us today, and have a great evening. Thank you so much.
Thank you, Boni.